Imagine your body as a vast, bustling city made of trillions of tiny building blocks called cells. Normally, these cells follow a strict set of rules. They grow when your body needs them, and they die when they are old or damaged. This is a perfectly orchestrated process that keeps you healthy. Cancer begins when this orderly system breaks down. It starts with just one cell that defies the rules. This rogue cell begins to grow and divide uncontrollably, ignoring the signals to stop. It doesn't die when it should. Instead, it creates millions of copies of itself, forming a lump or a mass that we call a tumor. This process can begin in any part of the body. It might start in your lungs, your skin, your colon, or even your blood. Because our bodies are made of cells everywhere, cancer has the potential to arise from virtually any tissue or organ. Not all tumors are cancerous. Some are benign, meaning they do not spread to other parts of the body and are not life-threatening. Malignant tumors, however, are the ones we define as cancer. These are far more dangerous because they have the ability to invade nearby tissues and spread to distant parts of the body, a process known as metastasis. The human body has a remarkable defense system. It is designed to find and destroy cells that are not functioning correctly, including those that could become cancerous. Specialized immune cells patrol our systems, looking for troublemakers. However, sometimes these cancer cells are clever. They can develop ways to hide from the immune system or to disable its response. When this happens, the abnormal cells can continue to multiply without being checked. This allows the tumor to grow larger and become more established, making it a much greater challenge for the body to handle on its own. Ultimately, cancer is a disease of our own cells gone wrong. It is not an external virus or bacteria that invades us, but a rebellion from within. As these cancerous cells multiply, they can disrupt the normal function of the organ where they started. They consume energy and nutrients that your healthy cells need. If they spread or metastasize, they can form new tumors in critical organs like the liver, brain, or bones. This widespread disruption is what makes cancer such a formidable and complex disease to confront, affecting the body's entire system. The fundamental cause of cancer lies in our genes. Specifically, it is caused by changes or mutations to the DNA within our cells. DNA is like the instruction manual for each cell, telling it how to grow, function, and divide. When this manual gets damaged, the instructions can become garbled. Some mutations might tell a cell to divide relentlessly, while others might disable the stop signal that normally halts growth. While some people are born with certain genetic mutations that put them at a higher risk for developing cancer, these inherited cases are not the most common. Most cancer-causing mutations occur during a person's lifetime. Many of these mutations are linked directly to our lifestyle choices. Smoking tobacco is perhaps the most well-known example. The chemicals in cigarette smoke directly damage the DNA in the cells of the lungs and other parts of the body, significantly increasing the risk of various cancers. Similarly, what we eat and how active we are play crucial roles. A diet high in processed meats and low in fruits and vegetables, combined with a lack of regular physical activity, can contribute to obesity. Excess body fat can lead to chronic inflammation and hormonal changes that promote cancer cell growth, particularly for cancers of the breast, colon, and pancreas. Beyond our personal habits, environmental factors also play a significant part. Prolonged and unprotected exposure to ultraviolet radiation from the sun is a primary cause of skin cancer. The UV rays can damage the DNA in skin cells, leading to uncontrolled growth. Other environmental risks include exposure to certain chemicals and substances in the workplace or the home, such as asbestos, radon gas, and industrial pollutants. These carcinogens, or cancer-causing agents, can initiate the cellular changes that lead to the disease over many years of exposure, often without the person even being aware of the danger they are facing daily. It is important to understand that cancer rarely has a single cause. It is most often the result of a complex interplay between our genetic predispositions, our lifestyle choices, and our environmental exposures over many years. A person might have a genetic susceptibility, but it could be a lifestyle factor like smoking that ultimately triggers the development of the disease. This accumulation of mutations over time is why the risk of cancer generally increases as we get older. The longer we live, the more opportunities there are for our cellular DNA to sustain damage that our bodies cannot fully repair. While cancer can affect any part of the body, some types are more prevalent than others. Understanding these common forms is a critical first step towards awareness. Breast cancer is one of the most frequently diagnosed cancers, primarily in women, but also occurring in men. It often begins in the cells of the milk-producing ducts. Lung cancer remains a leading cause of cancer death worldwide, strongly linked to smoking. Prostate cancer is very common in men, developing in the small walnut-shaped gland that produces seminal fluid. These three represent a significant portion of cancer diagnoses each year. There are other common types that everyone should be aware of. Colorectal cancer, which affects the colon or rectum, often starts as a small, non-cancerous clump of cells called a polyp. Over time, some of these polyps can become cancerous. Skin cancer, particularly melanoma, is another prevalent form, largely caused by exposure to UV radiation from the sun or tanning beds. Finally, leukemia is a cancer of the body's blood-forming tissues, including the bone marrow and the lymphatic system. Unlike other cancers that form solid tumors, leukemia involves the production of a large number of abnormal white blood cells. Recognizing the potential symptoms of cancer is vital because early detection can dramatically improve the chances of successful treatment. It is crucial to listen to your body and notice any persistent and unexplained changes. One of the most common signs is a lump or thickening that can be felt under the skin, particularly in the breast or testicles. Unexplained weight loss, where you lose a significant amount of weight without trying, can also be a red flag. Persistent fatigue that does not improve with rest is another symptom that should not be ignored, as it can be a sign that cancer is affecting your body's energy reserves. Other important warning signs include changes in your skin, such as a new mole or a change in an existing one, or a sore that does not heal. A nagging cough or hoarseness that lingers for weeks could be a sign of lung cancer. Changes in bowel or bladder habits, like persistent constipation, diarrhea, or blood in the urine or stool, should always be investigated by a doctor. Similarly, persistent indigestion or difficulty swallowing can be symptoms of cancers in the digestive tract. While these symptoms can be caused by many other less serious conditions, it is always best to get them checked out promptly. When a doctor suspects cancer, a careful and systematic diagnostic process begins. This usually starts with a physical exam and a detailed discussion of your symptoms and medical history. If there is a concern, the doctor will likely order further tests. Imaging scans such as X-rays, kinetic scans, and MRI scans are used to get a detailed picture of the inside of your body, helping to locate a tumor and see if it has spread. Blood tests can also provide important clues, detecting certain proteins or markers that are sometimes released by cancer cells. However, the definitive way to diagnose most cancers is with a biopsy. During a biopsy, a doctor takes a small sample of tissue from the suspected area. This tissue is then sent to a laboratory where a specialist called a pathologist examines it under a microscope. The pathologist can determine if cancer cells are present, and if so, what type of cancer it is. This confirmation is the most critical step in the diagnostic journey, as it provides the precise information needed to plan the most effective course of treatment for the individual patient. Modern medicine offers several powerful ways to treat cancer, and the approach is often tailored to the specific type and stage of the disease. Surgery is a common treatment, with the goal of physically removing the cancerous tumor from the body. Chemotherapy uses powerful drugs to kill fast-growing cells, including cancer cells, throughout the body. Radiation therapy uses high-energy rays, similar to X-rays, to target and destroy cancer cells in a specific area. More recently, newer treatments like immunotherapy, which helps your own immune system fight cancer, and targeted therapy, which uses drugs that attack specific vulnerabilities in cancer cells, have revolutionized care. While we have made incredible strides in treatment, prevention remains our most powerful weapon in the fight against cancer. You can significantly lower your risk by making simple, healthy choices. Avoid smoking and limit your alcohol consumption. Eat a balanced diet rich in fruits, vegetables, and whole grains, and try to limit processed foods. Maintain a healthy weight and incorporate regular physical activity into your daily routine. Protect your skin from the sun by using sunscreen and wearing protective clothing. Finally, participate in regular cancer screening programs, as they can help detect cancer early when it is most treatable. These simple steps can empower you to take control of your health.